Hi, I'm Dr. Avinash Mahale, consultant orthopedic surgeon and joint replacement surgeon affiliated to Lilavati Hospital. And today I'll be a bit about myself and a bit about common approach to knee disorders, as there is a lot of speculation about when to do the knee replacements and a lot of people are coming to my clinic with confused minds. So this is just a general insight into the knee problem so that you are not disillusioned with the fact that you always have to undergo a knee replacement once you cross a particular age. So commonly what I'm noticing is that people are coming to me with a lot of baffled minds and they are worried about the fact they may require a knee replacement. But there are a lot of knee disorders which have to be taken into consideration, and many times the diagnosis is missed by the clinician. So here is where the specialist knee services offer, is that we need to give you the exact diagnosis and the treatment rather than just focusing on one particular operation, which is not a lifelong operation. And I practice knee replacements day in and day out. However, the patients which are chosen with a lot of dialect and a lot of intricacies and specificity. Now what I mean by that is the knee joint is divided into three compartments: the medial compartment, the patellofemoral compartment and the lateral compartment. So arthritis usually sets in the medial compartment and you land up with a deformity of the knee. Many times the arthritis in certain middle-aged individuals, especially ladies, starts under the kneecap, which is in the patellofemoral joint, where the little wear and tear process starts. And this is where the panic begins, because you have a 40-year-old lady who have come to me with knee pain and then suddenly she's been advised knee replacement by a handful of surgeons, or a 50-year-old lady with a similar ongoing problem where the rest of the joint is pretty normal. So there are a lot of intermediate forms of treatment which are available when these cartilage disorders come up. But surprisingly, there are a lot of other problems also which people have. For example, when I get a patient with a knee pain, many times there is a background of any inflammatory arthritis. Sometimes uric acid may be a contributory factor. Sometimes rheumatoid arthritis may be a contributory factor, and they get marvelous relief after they are even put on medical treatment. Sometimes they've got alignment issues. Like for example, the patellofemoral joint can have a maltracking patella. It can have weakness of the quadriceps muscles, and we just work on simple things like correcting their flat foot, correcting the Q angle in the knee, and correcting the patellofemoral maltracking, and a lot of their symptoms improve. So one does not have to be really baffled that you have to undergo surgery all the time. Yes, we are surgeons, we like to operate on our patients, but provided we pick up the right patient so that the indication of the surgery gets streamlined and we get the best possible outcome because we provide the best possible diagnosis. Yes, there are other modalities of treatment which we consider, like for example, we do investigations in the form of CAT scans, MRI scans to get further information on the knee. I would like to give another example. Recently, I saw a 53-year-old lady who was offered a knee replacement. However, she had developed mechanical symptoms in the last 3 to 4 months. MRI revealed that she had a subtle tear of the meniscus, which is like a shock absorber in the knee joint. Her cartilage was not too bad. There was a little marginal reduction of the joint space. So what I landed up doing was a simple keyhole surgery and trimming of the meniscus, which completely took her symptoms away. So here is what the difference can be. Now the knee will last her another 5 years to 10 years before she undergoes a knee replacement surgery. And obviously, when the knee replacement surgery is bound to happen, it is bound to happen. So getting the correct diagnosis for which part of the joint, it is extremely important. And that your clinician has to be skilled, trained, and experienced to do so. Otherwise, he'll end up with doing premature knee replacements. You will be surprised, but even in the US, the incidence of unnecessary knee replacements is around 30%. We do knee replacements all the time, but the correct patient has to be identified. And another important thing is, which are the best patients? The best patients are usually who are little elderly, after 55-60 years of age, who have a severe pain in the knee. X-ray shows advanced signs of joint degeneration like tricompartmental arthritis, and the pain which is affecting their quality of life and affecting their walking and sleeping. I hope it will give you a clear message that not all knee problems require a knee replacement, but we are the specialists to guide you. Thank you.